Hello, and thank you for joining us for our webinar regarding the Washington Link for Health Clinical Data Repository, or CDR. My name is Mackenzie McCormick, and I serve as the Communications Consultant for the project. First, some background. Our main goal for the Link for Health CDR is to create a tool available to the community to assist in the sharing of healthcare information for the purpose of coordinating care and improving the health outcomes for residents of Washington. To do this, we want to leverage the investment that the federal government has made through meaningful use incentives to foster the adoption of electronic health records, also known as electronic medical records. The CDR is a staged multi-year effort. The first stage will go live in Q4 2016 and will include clinical summaries and claims encounter data for Apple Health enrollees assigned to managed care. Various organizations sponsor the lives they are responsible for in the CDR. Oversight of the collection, governance, and use of clinical information is an important role when they become sponsors of CDR services. HCA is the first sponsor for our Medicaid consumers. For Stage 2, HCA will add additional lives, and One Healthport will partner with additional sponsors across the state. It is also important to note that it will take time for the CDR to build up clinical data to reach critical mass in a robust longitudinal record, but it will build steadily. The CDR is the result of collaboration between HCA and our key partner, One Healthport. They have been the designated state health information exchange since 2009, operating with independent oversight. They provide a variety of services, with the newest one hosting the CDR in response to increasing interest in standardized clinical information exchange. There are many important features and benefits of the CDR. The main features include supporting the clinical data exchange between organizations without similar platforms, aggregating clinical and administrative data into a longitudinal patient record, and providing scalability makes it available for additional groups of patients beyond Medicaid. The main benefits include helping providers meet ongoing meaningful use objectives to qualify for additional incentive payments, and providing mainstream reporting and analytic capabilities for providers and MCOs. What data will be in the CDR? Many types of data will be in the CDR. Clinical summaries will be sent in an electronic format called Continuity of Care Document, or CCD. These CCD contain building blocks, information components, which can be used in many formats and, when assembled, providing the overall health picture of an individual at a point in time. Some of those building blocks are shown here. How can users access the CDR? Users have two ways to access data in the CDR. If they do not have an electronic health record, they can simply go to a web portal and view the data there. If they have an EHR system, they can import data from the CDR into their EHR and then view it using their standard workflow. How does the data move related to the CDR? Certified provider EHR systems connect to the One Healthport Health Exchange using standard protocols. The provider EHR pushes a standardized clinical summary document to the CDR through the exchange after each encounter with an Apple Health patient. The clinical documents for that patient are aggregated in the CDR. As the CDR gains critical mass, it will be possible for the provider to then query the CDR through their HIE connection, and the CDR will then send any relevant information on that patient to the provider's own EHR to view. For those without an EHR, a secure web portal is offered for clinical organizations to view CDR data from other providers caring for that patient. How is privacy and security of data protected? A great deal of work has gone into providing appropriate privacy and security as data is submitted to the CDR and then viewed. The CDR complies with state and federal security and privacy requirements and has completed security audits based on national standards. Finally, HCA and other payers or providers sponsoring lives in the CDR set all policies related to data protection and access. Users will be assigned CDR access by their organization based on their role. For example, physicians, therapists, auditors, managers, or case managers could be given different access rights based on what information they would need to do their job. Each organization has an access administrator who will work with management to determine staff access levels. Finally, data in the CDR is classified by the organization submitting it as normal, restricted, or very restricted. Only data classified as normal will be in the CDR for Stage 1. How much does the CDR cost? Organizations that participate in the CDR to submit or view data must join the One HealthPort HIE. They need to establish a trust agreement to securely exchange information. The cost to a provider organization to join the HIE is an annual subscription fee based on their annual net patient revenue. Those fees are shown here on the chart. There are no per-transaction fees. The CDR leverages the standards already present in certified EHRs. EHR vendors' readiness to send the clinical summaries may vary. Providers should confirm what, if any, additional fees their EHR vendors may charge. Next steps. Visit the HCA website for more information on the Clinical Data Repository and for a copy of this webinar. If you have any questions, please send an email to healthit@hca.wa.gov and put CDR in the subject line. Contact One HealthPort for general questions about joining the HIE to connect to the CDR or for other technical questions. Thank you for participating, and we appreciate your partnership in this endeavor to improve the coordination of care within Washington State.